The objectives for today's lecture are to review the Terms to Know 12, which we're due on Saturday, the discussion board. You guys really need to make sure you're posting on time by Saturday night in order to receive full credit. Every time you post a day late, it's 15% off, and participation is a big chunk of your grade, so it's important that you're posting those on time each week. After we go over those two things, we'll go over, finish up the age and sex related differences and how that affects resistance training or exercise. We're going to begin the psychology of athletic preparation and performance, so the mental aspect of training, and then Terms to Know 13 and discussion board 13 will be assigned as well. You guys did pretty well with these definitions. The main difference, or the one point that I did notice that some people missed some points off for, was resistance exercise, and that should have been just taken right from the PowerPoint that was covered in the Lecture 12 PowerPoint. Then we had these two questions, which you had to listen to the video in order to get the answers to these two. In the video, I had discussed that although males are greater in strength levels, when that's only because they have more muscle area. So when you compare those relative to the cross-sectional area, so you take away the extra size that the male has, the strength is actually the same. So that was C, equal in males and females. So then when it's saying compared relative to cross-sectional area, so you're comparing an apple to an apple, the same cross-sectional area from a woman to the same cross-sectional area of a man, so they're the same size, they have the same force production. That's an important point to remember. And then the second question that was covered extensively in the lecture regarding the increased knee injuries in college athletes, in female athletes. The discussion board also was built off that same question around knee injuries to females. So if you didn't know the answer to the previous question, you should have applied this discussion board topic to that question. And this is the slide that was taken out of lecture 12. A lot of you guys had good points about the ankle and contacting the ground when jumping, which is true for females. So to finish up the resistance training and the effects of age specifically, so for older adults. So this would be for adults 65 and older, more like your senior citizen category. You see a big drop off in strength, but that's mainly due to detraining. And here are some other changes you can see as a person ages over the age of 65. The bones become more fragile due to decreasing bone mineral density. So that is going to be, can be categorized as osteoporosis, which is an actual disease that's more severe that we learned about earlier, or osteopenia, which is not as severe as osteoporosis, but it still is a condition where the bone mineral density is significantly less than it should be, which results in less strength and density in bones and can be bigger concern for women than men. And then sarcopenia, the next word listed there, it's a loss of muscle mass. So that's going to be a decrease in cross-sectional area of individual muscles, a decrease in muscle density, and an increase in intramuscular fat. So you're having three factors go into that muscle loss, or also known as sarcopenia. So Muscle atrophy then is seen at a higher rate in the type 2 fibers. So if you can remember, those type 2 fibers are going to be the fast fibers. Those are the fibers that generate power. Those are going to see greater decreases than the type 1 fibers. And as a result of that, if the type 2 fibers are decreasing, you're going to have a higher proportion of type 1 fibers. So you'd be better suited for aerobic activities, lower intensity, as you age over the age of 65. Then this was interesting in a study. 40% of women 55 to 64, 45% of women 65 to 74, and 65% of women 75 to 84 were unable to lift 10 pounds. That's a big problem. How is a person like that going to be able to function in their daily life if you can't lift 10 pounds? A lot of things that you do throughout the day would require you to lift at least 10 pounds. Think of getting your groceries or doing your laundry, anything like that. It would become difficult for someone at this age level, especially in the 75 to 84 range. And ultimately, that's going to decrease the chances of living independently. And in that last note, that power decreases more rapidly than strength. Well, you could have guessed that because type 2 fibers are decreasing more than type 1 fibers, and power is associated with type 2 muscle fibers. So you should have been able to come up with that. So resistance training for older adults. So you see that the body is decreasing, its muscle atrophy is becoming apparent. So what can you do to help combat this? And actually, the body still shows positive effects from resistance training. You're not going to see the great positive gains that you would in a younger adult, but you do see positive effects when applying resistance training for older adults. And some of those positive effects would be decreased risk of injury. As I mentioned before, promote independent living, so keep that adult living independently as long as possible, and improve quality of life. If they can do more things, their life is overall going to be better. If they're really restricted in the type of activities they can do, that is going to lead to a large number of problems for that person to be able to continue to live independently. So if you had a client over the age of 65, what should you keep in mind when designing a program for them? Well, first of all, before you help this client out at all, they have to fill out a medical history and risk factor questionnaire. In some cases, it might be necessary for a doctor to clear this person before they can start any type of training. A 1-rep max test is appropriate for a strength assessment in an older individual. So you can still use that to get that base level to use for assigning weights throughout your training programs. You should begin at low intensity, and proper form should always be stressed. Obviously, that should be done in any case, but especially with older individuals, you don't want the joints to be stressed in incorrect ways when they're lifting with incorrect techniques. The major focus of your program should be to get this person to be able to live independently, like we discussed, and improve the ADLs, or activities of daily life. So the major muscle groups involved in that, the prime movers, your quads, hamstring, muscles of your core, back, those should be stressed when creating programs for older individuals. Initially, you should start at one set of each exercise, or 8 to 12 reps, and it should be about 40 to 50% of the 1-rep max. So if your 1-rep max on a bench press was 100 pounds, then it should be between 40 to 50 pounds that you would be lifting 8 to 12 times for only one set. So the last point there listed on the slide is lower frequency is recommended. So With the younger children, I believe it was up to 4 times a week that you could be doing different activities, and now it's going to be 2 times per week. So they shouldn't be, in a resistance program more than 2 times per week because their bodies need more time to recover. Some safety recommendations. You can read through those on your own. Just as I mentioned before, that 48 to 72 hours of recovery between exercise session. They need that recovery time. And then you're going to be responsible for looking up the Valsalva maneuver. Now this is a chart just basically going through a characteristic, and as the body ages, what happens to it, and then what happens with resistance training. So you can see the trend on here that resistance training still gives you those positive effects, even though your aging is giving negative effects. So it's a good way to counteract the aging process. So now we're going to move into psychology of athletic preparation and performance. So 2 primary influences to an athlete to be to affect their performance are going to be motivation and anxiety. So we're going to cover those things. So this basically falls under sports psychology, and that's kind of like a branch of exercise science. And it pretty much, the job of sports psychology is to understand the way that the mind affects the body in a certain skill, movement, or a sport or something like that. And the 3 major goals of sports psychology are listed there, and you can kind of read through those. Those are not critical pieces to know, but I just wanted to throw those on there so you could see them. So what is anxiety? Anxiety is defined as subjective experience of apprehension and uncertainty accompanied by elevated autonomic and voluntary neural outflow and increased endocrine activity. This can positively, negatively, or show no effect to an athlete's personality or the sport. It really does depend on that athlete's personality. Some athletes might be negative influenced by anxiety. Other athletes might thrive on that anxiety. So it really just depends on the type of person, the type of personality the athlete has. There's 2 different types of anxiety. Cognitive anxiety relates to psychological processes and worrisome thoughts. So this would be that talk inside your head that is, always leaning towards the negative. Oh, I don't want to drop this pass, then we might lose the game. So that would be the type of cognitive anxiety. Whereas somatic anxiety relates to physical symptoms, such as tense muscles, tachycardia, or quote unquote butterflies. So that would be like a physical manifestation of anxiety. So you'd actually be feeling things in your body. And sometimes you can even see, I know somebody is very nervous, you might even see them physically shaking. That would be somatic anxiety. Stress is another thing that can affect performance. And there's 2 different types of stress. Distress is a negative stress, so that would be something that would negatively impact your performance. And eustress is a positive stress. So the eustress would be like kind of getting psyched up for a game. That would be eustress. And distress would kind of be like that anxiety, either cognitive or somatic. So what is the ideal state an athlete should be in when performing? Well, here's a list of certain things that should be identified in an athlete. They should have an absence of fear. You shouldn't be having that cognitive anxiety thinking, well, what if I don't do this? What if I do that? I'm not going to be able to do this. That is not part of an ideal performance stage. There should be no fear of failure in the athlete's mind, no thinking or analyzing of performance. Now, you might think person should be thinking about every single thing they're going to do. And in some situations that could be helpful, but to get to this ideal performance state, you should have already rehearsed that and learned that, and you should just be able to do that in the moment. A narrow focus of attention, that would be, if you've ever heard a professional athlete or an Olympic athlete say, I couldn't even hear the crowd. I was just focused on the race. That would be their attention is only on their race, and they truly cannot hear and notice anything else besides themselves in that moment. And that's part of that ideal performance state. A sense of effortlessness. Because that athlete has done it so many times, when they execute it in that moment, it's no longer difficult. It's just a practiced task that they can just execute. A sense of personal control, so they feel that they can control the outcome of whatever they're doing. And then a distortion of time and space, in which time seems to slow. Oftentimes you hear athletes refer to this, that it was like time slowed down when they were, in a 100-meter dash, or running for the end zone, or shooting the last penalty kick, whatever their task was. It kind of goes hand in hand with that narrow focus of attention, that not only do they block everything else out, but it's like that leading up to that moment of execution, it's almost as if the time is slowing down. And then this is just the definition of the ideal performance state. So then these are some other motivational pieces. So an intrinsic motivation is something that comes from within. So if you're intrinsically motivated, you don't need anybody to tell you, step it up, pick it up. You're already doing that. Your drive to complete a skill or a task comes from within. Then you have a different style of motivation, achievement motivation, and there's two types of categories that an athlete would fall into. Either that athlete wants to achieve success, and that's why they're motivated, or the athlete wants to avoid failure. So it's about 50-50, this breakdown in athletes. Why is this important? Is because as a coach, you would need to know, or a trainer, you would need to know your client and what type of category this person fits into. It's important because when you approach them, or you're trying to give them some sort of external motivation, you'd need to know what is going to be effective to them. And then the last point up here is positive and negative reinforcement in coaching or training. Okay, so positive reinforcement is the act of increasing the probability of occurrence of a given behavior by following with an action, object, or event such as praise, decals on the helmet, or prize or awards. So sometimes if you watch college football, you'll see that a lot of schools have stickers on their helmet for every tackle that they make, or for every catch they make if they're a receiver. Sometimes coaches give little buttons or pins out to their players for being a player of the game or something like that. That would be a positive reinforcement. Whereas comparing that to negative reinforcement, the goal of negative reinforcement is to increase the probability of an occurrence of a given operant by removing an act, object, or event that is typically adverse. For example, if a team particularly hustled in practice, then the coach would announce that no wind sprints would be required at the end of the session. So this type of, although it says negative reinforcement, it is not truly negative. It is just negative because it's removing something. So in that situation, the coach was reinforcing, reinforcement style forces attention on what the athlete did correctly. So they hustled in practice, so they removed the wind sprints. Although it's called negative reinforcement, it really isn't negative. It's just negative because something is being taken away. Positive punishment is the presentation of an act, object, or event following a behavior that could decrease the behavior's occurrence. So an example is reprimanding a player after he or she fumbled it if they were a football player. Negative punishment would be the removal of something valued. Could take the form of revoking privileges or playing time, something like benching. Okay, so the first example of the player who fumbled it and the coach went and reprimanded the player for the fumble, that's positive punishment. Negative punishment, negative again, you're taking something away. That coach, instead of going and reprimanding the player, they just sit the player on the bench. So the thing that has been taken away is playing time in that situation. That's the end of the lecture today. These are the terms to know. So there's 13 different terms, 2 points per term. So 26 points off this. And then 2 questions to answer, 3 points each with those. Please do not forget to do the discussion board, and these are both due by next Saturday.